Good afternoon. My name is Lucas Duffy, and this is the Project 2 presentation for ME 597, Decision Making in Engineering Design. And today we will be discussing nudge theory as well as a critical analysis essay. So the agenda for today's discussion will be introducing the concept of nudge theory and the authors that wrote it. We will look at a brief example from the book that introduces some of the key concepts, and then we will go more in depth into two different sections of the book. The first section being part 3 on health, looking at medical decisions in the United States in particular, and then the fourth section on freedom and how freedom and freedom of choice plays into nudging people into better decision making. And then we will be looking at a critical analysis essay written by behavioral analysts and their criticisms on the inclusion or exclusion of behavioral analytics in nudge theory. We will finish the presentation with some final thoughts and learning that I took away from the project. So nudge theory, in doing research for this project, I found introductions of nudge theory in literature dating back to the 90s, but for the purposes of this presentation, we will assume that it was really popularized by Richard Thaler and Cass Sunstein in their book, Nudge, Improving Decisions About Health, Wealth, and Happiness. This book was written in 2007. So some of the concepts and events that they refer to will be a little bit dated, but in general, all of the concepts are still very relevant, even 14, 15 years later. And so they introduced this idea of a nudge, and from a high level, a nudge is how can we alter choice architecture and how that choice architecture affects the way that we make decisions in everyday life, without forbidding any possible options or the choice to not partake in that nudge. In addition, Richard Thaler won the Nobel Peace Prize for Economics in 2017 for his contributions to behavioral economics, of which include his idea of nudge theory. So the first example from the book was that of a cafeteria and the school administration recognizing that based on the choice architecture or the decisions that they made about the placement of the food, they could heavily influence the food choices that students made. And so they recognized that the foods that were placed at eye level for the students were very often the foods that would be chosen. And so this introduces the idea of default choice. So if the French fries are the first thing the student sees, they're very likely to choose the French fries. If the students are seeing carrots and other vegetables, they're very likely to choose carrots and other vegetables. And so in recognizing that they could heavily influence the choices that the students made, they needed to decide whether or not they would in fact influence those decisions, because they recognized that the most fair thing they could do was to put the food completely at random in all the different schools. However, some students would be encouraged to eat healthier foods. Some students would be encouraged to eat more expensive foods. And so what was the correct decision for how to influence the students and the food choices that they were making? And it is here that Thaler introduces this idea of libertarian paternalism, and applies this to the cafeteria example that we're talking about. And so libertarian meaning freedom. So we want to maximize the freedom of choice as much as possible. But then this qualifier of paternalism. And paternalism being nudging people towards decisions that will ultimately make their lives better. So when we're looking at this example of a cafeteria food choice, we can generally agree that we would like students to make healthier food choices. And so if we employ this idea of libertarian paternalism, we will nudge the students towards the healthier options, but we will also let them choose the unhealthy or maybe better tasting food options if they so choose. But we would like to nudge them towards making healthy food decisions. And again, this is an example that is shared in the introduction of this nudge theory book. So now we're going to talk about part 3 of the book. So this was on two different health decisions, mostly in the United States. And so the first example we're going to look at is Part D prescription drug coverage in the United States, which was introduced by the Bush administration. And then we're going to look at how can we increase organ donations in the United States, again, by altering this choice architecture. So the first example that we're looking at is the Bush administration introduced Part D prescription drug coverage as part of their administration policy. And the policy here was really to maximize choice for the consumer. So create as many different options for prescription drug coverage and then allow people to make decisions for the best program that worked for them. Now, unfortunately, according to the author, we introduced this idea of humans are not econs. And so humans, while we want to make rational decisions, are not econs. So we're not econs, meaning we don't have the ability to intake all of the information available. So there were so many different choices available in this prescription drug coverage option that there was no way that any rational person, particularly those most affected by this program, which would be senior citizens, were going to have the ability to make the best decision for themselves simply because there was too much information. Additionally, some of the statistics that were used to evaluate whether or not this Part D prescription drug coverage program was being successful was not very representative of whether it was. And so the author looks at the statistic that only 6% of consumers change their plans after the first year. So this could mean that the program is working very well and that patients are making the best choices for themselves. However, the author argues here that only 6% change plans because they simply were not armed with the correct information in order to make the best decision for themselves and for their health. And so the author introduces a couple different ideas here, one being a recap. And so a recap would let a patient know, based on the plan of choice for that current year, all of the costs that were incurred, all the benefits that they got, and then what would be some other plans that might prove to be a better decision for them based on their individual needs. And again, this goes back to the idea of arming the consumer with the most information that is relevant to them. The second nudge that the author introduces here is this idea of intelligent assignment. And intelligent assignment comes back to default choice. So in our cafeteria example, we saw that whichever food was the default or immediately in front of the student was more likely to be chosen. And so intelligent assignment for this example refers to patients that don't make a decision about which plan they want to choose. We should put some forethought into what the default plan will be for those people that don't make an active choice. And one of the examples that the author uses here is in the University of Chicago, where the author works. Every year, people have to make decisions about what drug coverage they would like and what health insurance they would like, and even in an academic setting with people that are working full time, very often people will not take an active choice in what health insurance plan they would want, and so this intelligent assignment is very important because there are a lot of people that will not make a default decision, or people that won't make a decision. We need to have some thought go into what that default choice is for those people. And unfortunately, the Bush administration randomly assigned people that did not make did not make a decision about what drug coverage plan they wanted. They were simply assigned one at random, and as you can imagine, that certainly does not maximize utility if a patient is randomly assigned to a drug coverage plan. The the second scenario that's introduced here is how can we increase organ donations, particularly in the United States? And so the author introduces this idea by looking at a survey that was done on Iowa drivers, and so 90% of these eligible donors wanted to be organ donors. However, only 43% of those people that wanted to be donors are actually registered as donors. So obviously there is a disconnect between the desire of eligible donors to be a donor and the people that actually are donors at the end of the day. And so what Thaler argues for is that there's multiple barriers and bad default choices that are going to discourage patients from being classified as donors. And so again, we introduced two different nudges that might increase organ donations by increasing the number of people that are signing up to be donors. So the first idea is this idea of routine removal, and that would mean that the patient or person that becomes eligible to be a donor in that tragic scenario no longer has control, or their family no longer has control over what happens to their healthy organs. So if a patient or if someone is in a car accident and they are presumed to be brain dead, then it would be almost the obligation of the hospital system to harvest as many of those organs as they possibly could, and the family would have no say. And so that would be an idea of routine removal. So we would routinely remove organs from those donors, or everyone would be a donor. Presumed consent, which Thaler talks about as probably being a more accepted nudge that could be used, would be that we would assume that everyone would want to be a donor and that they would have to opt out. And again, this comes back to that idea of default choice. So we know that if we assume that most people want to be donors, and 90% of those people, based on our study that we've looked at, want to be donors, then 90% would end up being donors at the end of the day, instead of this 43% that we see here. So these are two different nudges that the author introduces as ways to increase the number of people that are signed up as donors, therefore increasing the number of organ donors in the United States. The next section of the book that we used for the project was the section on freedom. And so we will first look at how to improve the public school system in the United States by increasing freedom of choice. And then we will also look at an idea of how to reduce healthcare costs in the United States by reducing the right of patients to sue their providers for malpractice. So in this idea of increasing freedom of school choice, the author is arguing that that by increasing and improving the competition in public schools, we're actually going to be creating equality for all students, as well as for the parents that are choosing where their students go to school. And one example that the author uses is that wealthy families do have school choice because they can send their children to private schools if they so choose, whereas students that are in that don't have the money to go to these private schools are oftentimes stuck with the neighborhood school and have no choice to go to another public school. And so this creates a negative impact on the less wealthy students. And one of the Bush administration programs was this No Child Left Behind system. And Thaler argues that No Child Left Behind, again, does not increase students' choice in the schools that they want to go to. And so therefore we really don't know which schools are poor performing, because because we can make the conclusion that if a school is poor performing and students have the option to not go to that school, they will go to other schools, and then we will see which schools are poor performing. We can increase the funding, increase the education at those poor performing schools, and therefore improve the education at all public schools. Another program that the author talks about is this Boston system. And so the Boston system is really about how to improve school choice, but not in a perfect way. And so there's this idea that based on how an application is filled out, students can choose what school they want to go to. So again, this system really only benefits the more educated or wealthier families that know how to work this system. And so how can we include more objective choice architecture in this system so that we can maximize the school choice for all students? So um, one of the parameters in this Boston system is what college does a student want to go to. Now, this is a very subjective question, and what they found was under the Boston system, students that wanted to go to Ivy League schools were more often given the school choice that they wanted, whereas students that chose community colleges were not given the school choice, and obviously that's not a fair system. And those that knew what schools to put down for their college of choice are given more advantage. So how can we make these objective choices, or how can we make these choices more objective for all students? Looking at things like demographics, what neighborhood you're from, and other parameters that improve the nudging decisions, pushing all students to better education systems. The next example in the freedom chapter that was looked at was removing a patient's right to sue medical providers, and how this would ultimately reduce insurance costs. So it might seem counterintuitive, but one of the first examples that the author introduces here is, what if in our education system students had the ability to sue professors for incorrect information, and how much more that would increase the cost of education, because schools and professors alike would need to make sure that they had the monetary means, if they ever got sued for teaching bad information. And if we now carry this example over to the medical system, we know that in the United States, you have the ability to sue your medical provider for malpractice. And so the author wanted to look at how effective is this system. So they looked at a New York hospital system over a period of 10 years. And what they found was that only 2% of the eligible cases for malpractice lawsuits were actually filed. And then of those 2%, 40% of that monetary payout was taken by lawyers, and then only 36% of those cases were actually paid out to patients that had physical harm. So again, we can see that the system is not benefiting the people that it really should, which are people that were physically harmed, or people that don't have the means to otherwise pay for their medical care. And unfortunately, the system of being able to sue your medical provider was really only being utilized by people that were wealthy, people that knew how to work the system, and people that may not have actually been physically harmed. And so the author's arguing that if we remove the ability to sue, and leave it up to patients and providers to draw up contractual parameters, this would do a much better job of setting the parameters of medical care, such as punitive damages if something does go wrong, or certain costs of procedures, or limiting the number of procedures. but that this would encourage much better interactions between patients and doctors, and these nudges in these contracts would objectively push healthcare costs down. So moving away from the book, we look at an essay that was written by a couple of behavioral analysts that are arguing for the inclusion of behavioral analysis in nudge theory. And so this essay begins by really acknowledging the importance of nudge theory in public policy. And that's something that we see through the book is how important this idea of nudge theory and libertarian paternalism is included in public policy decision making. Um, and behavioral analysis acknowledge how important nudge theory is into public policy, but they also want to include kind of this question or this answer to why. And so that's what behavioral analytics is based on, is you want to ask, or you want to answer the question of why a uh, person does what they do, or looking at what the specific mechanism of such behavior, or in this case, what the nudge actually is. And one of the important concepts that they discuss in the essay that they argue is not included in nudge theory is the cyclical nature of important events. So these events that influence our future decision making. So, for example, um, if someone has a traumatic or an important event, they are much more likely to make decisions that would steer them away from putting them into that into that situation again. And the authors are arguing that that is not included in nudge theory. So some final conclusions. Um, I think it's very obvious that nudge theory has had a very significant impact on the choice architecture in everyday life. Um, its inclusion in public policy means that nudge theory really has an effect on each and every person. Um, and a big learning I had about that choice architecture is the power of that default choice, and how important it is to think about um, the kind of the default choices or lack thereof, the choices that we don't make, and how that affects our behavior in our everyday life, but then also in our, how we can make better default choices for others. And in my essay, I discuss an example from my professional life in recommendations to leadership, and how presenting multiple choices to leadership, I probably want to think a little bit better about what is that first choice, what is that first default choice, because based on what we've learned in this book and this essay, we know that that will very likely be the choice that is chosen. And then a final takeaway that I had from nudge theory was really to be wary of nudges, and this is something that wasn't discussed in the book, but that nudges might not always be positive. We really only discuss public policy and private institution nudges that improve people's lives. But one nudge that I think would be important is important to think about is social media. And we know that the choice architecture and how we use social media, it really encourages us to use it more and more and more, and to keep the attention of the user as much as possible. And all of this choice architecture and social media is nudging. And I think there's a strong argument that that's not always positive, that people spend way too much time on social media. And so we need to think about how that choice architecture affects the decisions and the time that we spend on these sites every day. So something that I want to be more wary of is the nudging that affects my life and may not be completely positive for me. So those were some of the final thoughts and takeaways I had from the project. I enjoyed the project, and that is the end of the presentation.